Hi everyone, welcome to another oDOc webinar. I am Shivangi, and today we have a really interesting and an important topic, I believe, that we're here to discuss. Um, it's going to be a conversation on how to prevent obesity and malnutrition by eating healthy. Obesity is something majority of us have heard a lot. There's a lot of talk about it, but malnutrition is also equally important, and we need to give more attention to it, I believe, because it is also very, very common within the local population. So, to discuss this and to discuss cure versus prevention more in depth, we have Dr. Lasith Uyanege with us today. He obtained his MBBS from the Faculty of Medicine, University of Peradeniya in 2011. He completed his MSc in Human Nutrition in 2016 at the Postgraduate Institute of Medicine, University of Colombo. Dr. Lasith was awarded his MD in Clinical Nutrition by the very same institute too. He is currently consulting at the National Hospital in Kandy as a clinical nutritionist. Welcome, doctor. Thank you so much for taking the time off your busy schedule to have a conversation with me and our viewers on obesity and malnutrition, which, again, like I said, is something very, very important, and we need to be speaking about it. It is truly an honor to have you on board, doctor.
Good evening. Thank you very much for your kind introduction. So I'm very much happy to join with this oDOc team today, and thank you very much again for facilitating this event.
Great, thank you, Doctor. It's an honor. I would like to jump straight into the questions, Doctor, if you don't mind. But I would also like to tell the audience and the viewers who are watching, if you have any questions, please feel free to send us those questions across via the comment section below, and I will ask them from the doctor. So, Doctor, without any other further delay, shall I just jump straight into the questions for you?
Yes.
Great. So the first question I have for you, doctor, is the recorded obesity within the adult population was about 5.2%. That's quite a lot, and many specialists predict that this percentage is going to increase in the years to come, which is quite concerning. The general understanding is that obesity can be managed through diet and exercise. To what extent is this actually true? Also, are there anything else that people need to be aware of that would help them avoid being overweight?
Yeah, that's a very important question. So, because you know that, as you said, our obesity rates are rising in Sri Lanka. So, it is one of the main health problem in Sri Lanka. And not only in Sri Lanka, it is also it's a problem in worldwide. So mainly when it comes to the management of this obesity epidemic, there are mainly three parts. As you said, mainly the lifestyle modification, that is the dietary modification and physical activity change, activity improvement, and that is the lifestyle modification. Apart from that, there is another group that is very much important as much as the lifestyle modification, that is called behavior change. And so basically lifestyle modification and the behavior change are the main two methods we have to manage this obesity. Apart from those two aspects, there are some other options to manage this obesity, like drugs. There are some well evidence-based drugs which can be used to reduce the obesity. And for the resistant patient with severe obesity, there is another option called bariatric surgery that is also well performed in Sri Lanka, well established. So it is also another option. So those are the main options or the armamentarium we have to counteract this obesity. And when we talk about the lifestyle modification in relation to dietary management, it should be individualized, because as you all know that our dietary pattern differs from person to person. So we need to assess the dietary pattern, and we should identify what are the wrong dietary habits, and then we should inculcate small change to correct those wrong dietary habits. But in Sri Lanka, not only Sri Lanka, worldwide, the problem is many people or the obese patient are going to do a lot of dietary changes at once. So because of their hyper enthusiasm, they usually correct lot of dietary habits at once. But the problem is it is difficult because we have been eating for our lifetime, because our dietary pattern or the habit or the behavior has been uh, adapted, or there has been changed according to our lifestyle. So it is very difficult to change that sort of a behavior. One or 2 months you can do that because of your hyper enthusiasm, but usually your dietary pattern revert back to normal. So that's what I have been seeing, and I have been seeing a lot of patients who have successfully reduced their weight for about 1 or 2 or 3 months, but after that they couldn't uh, persistent with their dietary change. So that is a main problem. And so their weight initially their weight loss will be reverted and there will be weight regaining. So it is not good, because if we reduce your body weight by doing lifestyle modification, it should be persistent. Otherwise that there will be lot of health disadvantages. So the behavior change is very important. So behavior change, you may not be that aware, so I'll just talk on about this behavior change. Behavior change, yeah, the behavior change is we need to set weight losing target at the outset. So it's about 5 to 10%, but most of our patients want to reduce their weight by 50% or 60%. That is not possible at once. So you need to have a small achievable goal. It should be set at the outset, and it should be documented, and your weight should be weight should be monitored regularly, preferably at a static time. I mean, it's better to weigh your body weight in the morning, early in the morning, after voiding urine, and without taking any foods. That will reflect the correct body weight. Otherwise, your whatever you are drinking and whatever after eating foods, your body weight can be changed. And also with duration, the time as the day goes, our weight changes. So it should be done at a specific time, and it should be done early in the morning. And that is also behavior change. And also there are other aspects like in the behavior change, like you can do regular weighing. At least don't do it daily, because your body weight changes with daily as well, but it's not static. So it's at least 2 weekly or the monthly. And it should be, if you can maintain a diary, food diary, or the exercise physical activity diary, it would be another advantageous step. And also healthy food shopping, like if you can go to the if you all are going to supermarket, and you should be selecting healthy foods, and it should be stored in your fridge, because whenever you feel hunger, you usually open the fridge and eat. So if you have healthy foods at your home, so those will be eaten, and it will facilitate your healthy eating behavior. And the other thing is stimulus, that is called stimulus control. And also coping strategy, because when we put on your diet schedule, your pleasurable foods will be avoided, so you can get depression. So because we don't eat because we eat foods to get pleasure as well. So it should be done like that. So I think the behavior change is one part I want to highlight in this webinar. And the drugs and surgery, it is out of this webinar talk, so I am not going to touch those aspects. So apart from the lifestyle change, we should do this behavior change if you are to maintain your body weight, reduce your body weight, and maintain it for a longer time.
Great, thank you so much for that answer, Doctor. It was very, very insightful, and there was so much depth in all your answers. Thank you so much. I think a lot of people would have gained a lot of knowledge from that. We spoke about obesity. Let me just jump quickly into undernourishment. It's undernourishment being the opposite of obesity, basically, is another condition related to nutrients that we supply our body with. Is there a difference between the risk factors of obesity and malnutrition? Like, is one more harmful than the other? And for those who frequently suffer from like a loss of appetite, what would you suggest they do to overcome this? And given the Sri Lankan carb-heavy diet, does it play a role in supplementing the right nutrients to better manage these conditions?
Okay, it's a long question. I think there are about three parts. So I'll go one by one. So for the first part of the thing, the risk factors of the obesity. As you all know that diet play a major role in obesity. If you are eating a lot of high carbohydrate containing diet, it can increase your obesity risk. And also if you are eating a lot of oil and the sweets, those are give high energy. So that will increase your obesity risk because your excess energy will be stored as fat in your body. They are making you obese. So those are the dietary risk factors, and also there are other dietary risk factors as well, like reduce intake of foods, healthy foods, and increase intake of fast foods, biscuits, chocolates, and pizzas, and you know that there are a lot of junk foods available. Those can make you fat. So those are the dietary risk factors for obesity, and there are other, apart from that, other risk factors as well, like there are some diseases, the hormonal diseases like Cushing disease, which can cause, increase your body weight, which can make you fat, and polycystic ovarian syndrome, and there are a lot of diseases which are causing obesity, and some brain tumors, hypothalamic tumors, can make you obese. So we need to investigate, and we need to exclude those major or the dangerous condition, and to diagnose the simple obesity, and then we can cut down those risk factors, and we can adapt healthy eating behaviors. And reduction of physical activity is also main risk factor. I think it's very much aware for this audience that reduction of physical activity with high busy schedule is a risk factor. And because of this obesity, they can get a lot of complications. And you know that if you are getting central obesity, or the what we call if you are having high waist circumference, that increase the risk to develop diabetes, because your insulin resistance will be high, and diabetes, cholesterol, hypercholesterolemia, and hypertension, heart attacks, and also well-known complications of obesity. And not only that, the arthritis and the knee joint osteoarthritis problems, or the chronic headaches, and there are another thing which is very common, like obstructive sleep apnea. It is very common, the snoring, and they feel daytime somnolence, and they have high risk for ischemic heart disease. And those are very detrimental complications, but it is the main cause is the obesity, and the central obesity with high visceral fat. And not only the obesity, the undernutrition is also major problem in Sri Lanka. That's called double burden of the disease. And undernutrition, we need to for management, we need to we need to do the thorough assessment of the undernourished patient. Why this patient has got undernourished state? So whether the intake or the food intake is low, or whether there is any high catabolism, or that means high burning, high amount of burning, or the high metabolic rate in this patient, or whether there are any conditions or disease associated or causing this undernourishment, like cancers, and like chronic infections like tuberculosis, and or there are any other gastric or the gut problem, which affect in the digestion and absorption. So we need to investigate thoroughly in this patient to find out the cause of the undernourished state, and then we have to manage. And the third part, the high carb diet, is in Sri Lanka we eat 3 main meals, usually based on rice, and it is high amount of rice. We usually eat a lot of rice because because of that our other food groups are not taking as according to the guidelines. We can't eat much because we are eating a lot of rice, so other foods are not eaten, and so there could be deficiencies like vitamins deficiencies and mineral deficiencies and protein deficiency, because we usually eat a lot of carb based diet. So we need to cut down. If you are eating a lot of carbs and the rice, we need to cut down that carb amount, and and also that carb should be replaced with other foods like non-starchy vegetables and the lean proteins like eggs, fish, and chicken, and those stuffs, or the vegetable proteins like chickpea, green gram, and soya, TVP, except vegetable protein. Those, so then in that way we can have a healthy eating pattern, or the healthy eating. Your plate can be converted to healthy eating plate, so that and also you should eat 2 food servings per day, and 2 dairy servings as well, to get the required amount of vitamins and minerals. So likewise, we need to tailor-made our diet pattern to make it a healthy diet.
Thank you, doctor, for telling us being Sri Lankans and with our eating habits and our plating habits, how we should change it. Hopefully, a lot of people who are watching and who will watch later on will get some insight into it and start following your tips. So thank you for that. You earlier had also mentioned like good fats and bad fats. So I have a question regarding that. People are generally under the impression that all fats and oils are bad for the body. Is this really the case, doctor? And can oils be categorized as good fat / oil or bad? How should one manage their oil and fat consumption?
Yes, it is very important question, because in these days, you know that there are a lot of hahu regarding which oil to be used, and the oil usually it contains we can categorize into healthy oils and unhealthy oils. Healthy oils means which are containing unsaturated fat, and unsaturated fat containing oils are, the main oil is the olive oil, and other oils would be canola oil, sunflower oil, and soy oil. Those all are having unsaturated fat. Especially monounsaturated fat is healthier, and so those sort of oil are the healthy oils. But having said that, we need to remember that those oil need to be eaten or the used in healthy manner. Otherwise, if you use those sort of healthy oils for deep cooking or the deep frying, those healthy fat will be transferred to the trans fat, which is very dangerous fat, which is a very dangerous fat fat component, because it will increase your bad cholesterols and decrease your healthy cholesterol like HDL, leading to high cardiovascular risk. So healthy oil should be eaten in healthy manner, like if you can use it as a stir frying or the tempering. Those are healthy cooking methods, but those are the healthy oils need to be eaten in healthy manner. The other thing is, the other saturated fat usually considered as a considered to be a, it is considered as a unhealthy oil, because saturated fat usually increase your LDL, triglyceride, or the bad cholesterol, increasing your cardiovascular risk. Your blood vessel to the heart and to the brain will be blocked because of this atherosclerosis induced by the saturated fat. So what are the saturated fat containing oils? mainly the coconut oil, and coconut oil is having high amount of saturated fat. And but the important thing is coconut oil is having this saturated fat in arranged in medium chain triglyceride gas. The way of it arrangement is better. It's medium chain MCT. So the benefit is that MCT is highly absorbable to the body, and it's easily digestible and easily metabolizable. So it usually don't cause that amount of atherosclerosis, but you need to consume a small amount of this coconut oil. And it is, the plus point is it is health, it's heat stable. So you can use those coconut oil for deep frying as well. The trans fat formation is very much minimum. So it is one of the best oil in Sri Lanka, but you need to consume it in small amount, because the large amount of coconut oil, as for the deep frying, even for deep frying, it can increase the heart disease risk, because those are having high amount of energy, and that can increase your LDL as well. So recent evidences showing that, research evidences showing that the high amount of coconut oil is also bad for our health. So we need to have a balance between this coconut oil and the other healthy oils, and the trans fat should be avoided. It should not be eaten, because those will increase your heart attack risk and the stroke risk. So trans fat containing food should be minimized. And apart from this healthy oil, there are some foods which are having high amount of healthy oils, like unsaturated fat, like for example the avocado is having high amount of unsaturated fat, monounsaturated fat, but it has high amount of energy as well. So if you are obese, you need to cut down the portion, or the portion size of the avocado. Half of avocado would be fine. Otherwise, if you consider it as a healthy, and if you are eating lot of avocado, you will be fat because of high energy density. So likewise, you need to consider all the different aspects when we are eating foods. Not only the healthy oil, we need to use it as a healthy manner, healthy cooking method. Otherwise, the healthy oil can be dangerous as well if you are using it for the deep fry.
Great, thank you so much for that, doctor. Anything, if you take too much of something, it can go bad. That's what you said. So thank you for that. I think we're almost at the end of our webinar. So I'm going to ask you one last question, doctor. And this is something a lot of people had messaged and DM'd us asking too. So it's for, like, parents often find it really difficult to provide the right nutrients to their children, especially if the child is like a picky eater. What advice would you give to these parents, and how important is it to provide the right nutrients at the young age?
Yes, it is also a very good, important question. It's a timely question, I would say, because there are a lot of parents who are facing a lot of difficulties when it comes to feeding to their babies, because we know that for 6 months we usually feed breast milk exclusively, and after that we start complementary feeding, and you are not supposed to add any salt or sugar for this complementary foods up to 2 years. So because those salt and sugar, the taste will be developed once you add those foods, or once you add these things. Otherwise, baby doesn't have any sense of this salty taste or the sugary taste. So if you can delay the adding of those sugar and salt, it would be better, because they can develop healthy eating habits. And other than that, when we start complementary feeding, what happens is we are giving a lot of different textures and different foods to this baby who has been given breast milk only for last 6 months. So baby initially they will not eat, because they used to drink breast milk, but now we are giving rice based complementary food. So baby will refuse, and baby will spit it out. So lot of mothers would recognize this spitting out as a rejection or the dislike of this specific food group. So usually these mothers tend to stop and tend to avoid this food group for their during this baby's childhood. So that is bad, because it is physiologically, they say that the babies who have been breastfeeding, they have physiological neophobia. That means they are not like to eat foods because they have been fed with breast milk. So we need to identify this physiological neophobia, and we need to give the specific food item for about 10 to 15 times with about 2 or 3 days of interval to get it in, because otherwise baby usually put it out because he is not adapted to these foods. So that's called physiological neophobia. It is very common. It's maximally seen in first and second years of the age. So you need to identify that, and you need to give the food regularly, repeatedly, to give this food group to this baby. Otherwise, baby will not eat for their lifetime. It's a problem. And so that is physiological neophobia. And the other part is picky eating. Picky eating also some sort of extent of this physiological neophobia. These picky eaters, they usually eat food groups, but about 5 or 10 foods they usually avoid. But these picky eaters also, the problem is because of this picky eating, mothers will tend to do force feeding. So there will be behavior problems in this child. So the baby can be aggressive during the feeding time, and it can be a long-term problem like depression, and autism also can be linked with this picky eating. So mothers need to identify these behavior habits, and they need to do it in a calm manner. And the responsive feeding is very important. They need to get the child eating rather than feeding. So there should be a separate place. There should be a separate plate and place, and with minimum distraction to improve their eating habits. Otherwise, the force feeding and the destructive eating are not recommended, because those can lead to long-term behavior problems. So mothers need to identify their baby's eating pattern and correct it gradually, and should not and once these babies are not eating, the mother and grandmothers are what they do is they add salt and sugar to the complementary feeding. So baby will eat, but they have high cravings for these foods, so that will last for their adulthood as well, leading to a lot of unhealthy eating behaviors, leading to a lot of non-communicable disease. That's what we have been facing here in Sri Lankan setup as well.
Great, doctor. Thank you so much for that answer. I think you shed light on like a lot of things which are not really spoken about, and most young mothers and new mothers won't really know. So thank you for giving us that great insight. Unfortunately, we have come to the end of our session, doctor. So I will have to wrap up. Once again, thank you so much for taking time out, doctor, to be with us today, and for speaking about obesity, malnutrition, and giving us a lot of insights and tips into how to eat better, how to live better also. I surely learned a lot from you, and I'm sure the viewers did too. Thank you so much, doctor.
Thank you very much, oDOc team, for giving me this opportunity. Wonderful platform, and I think the audience would be benefited from this webinar, definitely.
Definitely, doctor. It was an honor to have you on board with us today on this webinar. Thanks again once more. And I would like to say to all the viewers, if you would like to consult Dr. Lasith, he is in a more private space or manner. He's available on oDOc. You can always consult him via oDOc. So once again, thank you so much, doctor. And I shall meet all of you guys again very soon with another webinar. If you have any ideas or like topics that you would like us to explore in our upcoming webinars, please do send us a DM. and we will 100% look into it. Until then, thank you so much once again, Doctor. Thanks a lot for being with us, and our viewers, thank you for watching. Just be indoors, be safe. Thank you very much.
Thank you.